Baby Harriet Hawkins was born dead at Nottingham City Hospital on the 17th of April 2016. She died as a result of a mismanaged labour, and an independent investigation has just concluded that her death was, quote, almost certainly preventable. Harriet's father, Jack, is a hospital consultant. Her mother, Sarah, is a senior physiotherapist. Both work for the hospital trust responsible for the death of their baby, their first child. Since that day, the couple have campaigned to force the trust to acknowledge it made mistakes. Mistakes which they believed had been covered up. You might remember them telling us such last year, but it's taken almost 2 years for an independent report to reach the same conclusion. Sarah had been in labour for 6 days. The couple had made 10 phone calls and 2 visits to the hospital. By the time she was finally admitted in the late stages of labour, their daughter had died. It took another 9 hours before Sarah was able to give birth. Sarah Hawkins is here, and so is Jack, and their solicitor as well, Janet Baker, we'll talk to in just a moment. When you read the words of the report that your daughter's death was almost certainly preventable, how did you respond?
I think it was a mixture of feelings, really. It was a relief to actually be heard and for there to be an official acknowledgement that, you know, Harriet's death was almost certainly preventable. It was just brilliant for the external review team to be open and honest and transparent, and that's all we had asked from anyone since Harriet died. I mean, but obviously with that, it brings great sadness because, as you say, it's a trust we work for. Minutes after Harriet's death, all we had been saying there were problems. They hadn't been open, they hadn't been honest or transparent, and we wouldn't be sat here today if they had. And it's been a very hard time.
Yeah. How did you respond, Jack?
Really much the same. I mean, it's very difficult when you know the truth and other people are telling you that, in essence, you've got it wrong. Feels like we've been accused of lying. I think it's worth mentioning that nobody from the hospital has listened to our story, which we've made copious notes on at the time. Nobody has sat down with us and said what actually happened. What they have done is listen to reports from other members of staff involved in her care that don't match with reality. And so it's been very tough. But having this report, it gives Nottingham no further opportunity to try and wriggle out of what actually happened. We are deeply concerned that in the 21 months or so since Harriet died, the problems have persisted, and they shouldn't have, and they didn't need to.
OK, we'll talk about that in a moment. It's worth reminding our audience that initially the hospital did its own internal investigation without your involvement.
Correct. And
concluded that staff made no errors, I beg your pardon, and that Harriet had died from an infection. You know a bit about infections, Jack, don't you? So you were able to challenge that almost immediately, and the pathologist report, saying that had there been an infection serious enough to kill Harriet, you would have been extremely unwell as her mother and probably required intensive care treatment. Also, for the benefit of our audience, an external review was carried out by a medical professional who the trust then offered a job to, and the draft report she'd done said Harriet's death was directly contributed to by 5 things. When you got the final report, it had been changed to say what?
That Harriet's death might have been prevented, but certainly might. So
might have been avoided.
Might have been avoided, thank you. And we thought that directly contributed to by was only just strong enough anyway, but it was a definite improvement on the internal report. But might, I'm afraid, is political speak.
I think the thing there is between the draft and the final report, it was only given for factual accuracy changing, and that is not a factual accuracy change.
Yes. And we asked the hospital to change it back, and they said it's not our policy to change back reports.
Yeah.
And we asked them to explain why it had changed, and they have never responded.
I want to ask you about the impact of your baby's death on you since then.
it is so hard to put into words. I don't feel like we've actually been able to grieve yet, because we have had this fight, you know, and all we've asked for is to be listened to and for the trust to be open. We want Harriet, you know, to be worth something, and for an improvement into the safety of their service. That was all we were asking, and we didn't get that, and we haven't got answers. We've got apologies, but apologies don't bring back our dead daughter.
And we're not sure what they're apologising for either. It feels a bit like a platitude rather than a direct apology about the various problems that we have faced with them.
Well, that's the statement I have from the Chief Executive of Nottingham University Hospitals NHS Trust. I offer my deepest sympathy to Sarah and Jack for the pain and distress the death of their daughter, Harriet, continues to cause them and their family. I profoundly apologise that we let them down and Harriet down so badly. We've acknowledged that it is likely Harriet would have survived had it not been for several shortcomings in care. Why do you say that's simply a platitude from your point of view?
We're disturbed that the report said almost certainly, and the Chief Executive has chosen to use the word likely. And again, it feels like an attempt to turn down the volume of what is a very clear report. To be fair to the Chief Executive, that is a step up from the previous apologies. So we don't want to be dismissive of that. But
how many apologies have you had by now?
Oh,
so far?
They might as well have signed off their emails with "sorry for adding to your distress."
Right.
It was.
And they also say they've made substantial changes to address the shortcomings in their systems of clinical care and governance that arose from the death of Harriet. They say they've strengthened the maternity leadership structure, improved the involvement of parents in the investigation process, and strengthened governance processes. Should that be reassuring to other patients in the area, other pregnant women?
The difficulty is we don't know the detail, and they should have shared with us the detail. Strengthening the maternity leadership is no doubt positive, but that wasn't the only criticism. There are a lot of criticisms about the processes and the way that the two maternity departments communicate and operate. We know, because it's been in the news recently, that they were criticised by the coroner in 2014 for conducting a woefully inadequate internal investigation.
So long before?
Long before. So we are
death.
shocked that in 2016 they are still conducting woefully inadequate internal investigations, because it's taken so long to get the hospital to believe us. We're very concerned what's been happening in the last 2 years, and there is a recent coroner's inquest that has concluded natural causes contributed to by neglect, and that is a very significant
For
comment.
a baby?
Yes.
At that same
Yes.
hospital? OK.
I think one of my concerns there is that they haven't actually addressed any clinical practice. And we asked why some of the clinicians who have been highlighted in the report as failing to deliver appropriate care haven't been referred to their governing bodies. The Trust responded with they didn't feel like they'd met the threshold for referral. And I'm not sure, you know, our daughter dying, I'm not sure what their threshold is for the referral.
Although a number of midwives, I think, have been retrained or sent on courses or whatever. 18 months you have been fighting for this. You both worked there. How difficult has that been?
We haven't. I went back to work for 3 months, but my job is not just at the hospital. That was very tough. But I got my P45 between Christmas and New Year, so I'm now unemployed.
I'm from next month I'm not getting paid because I'm unable to return to work. And Harriet is still in the hospital because we still haven't been able to have her funeral.
What?
Yeah.
How?
It's only because we've actually got official acknowledgement in this report that her death was almost certainly preventable, that we can now have it. But before the previous reports, they've always tried to blame a weakness in us, a weakness in Harriet, like the infection. So we haven't been able to have her funeral.
Right. Was that your choice, that you wanted to wait for a report that vindicated you, so you were going to leave the body of your baby there?
We were so shocked by their correlation between what actually happened and the pathology report that we didn't want to do something permanent that would provide useful information, and we were right. So the final report has been helped by us not having Harriet's cremation.
I understand.
And now that we have this, we wanted to wait for this to be published. It's been slightly delayed in being published, but not by the team who who wrote it.
But having your daughter
Yeah.
in lying in a mortuary for 20 months is not a pleasant feeling.
Janet Baker is the solicitor. What next?
We're going to refer the matter to the Crown Prosecution Service because we feel that there have been breaches of the Health Care Act 2008 in relation to the duty of candour. As can be seen, there was no initial...
So you're alleging that criminal offences may have been committed, when it came to the hospital being open and transparent about what actually did happen.
Yes, initially they didn't undertake an investigation at all. It was only as a result of pressure from Jack and Sarah that they did anything, although their own protocol required them to investigate this matter as a serious untoward incident. When they did investigate it, Jack and Sarah were not involved, and the report concluded that there was no fault on the part of any member of staff at the hospital, and that Harriet's death was caused by infection. The latest report, which is independent, has found that that was almost certainly not the case, and that the pathologist was given information which led him to conclude that it was probably infection, and not given the full clinical picture, which probably would have led him to a different conclusion. So we feel that that is sufficient ground for us to refer the matter to CPS to investigate under the Health and Social Care Act and the regulations which came into force in 2014. We're also going to refer to the Health and Safety Executive because the most recent report highlights patient safety issues and systemic errors which we're not convinced have been put right, and certainly were in existence at the time of Harriet's death and at least 5 months later when the other baby died in similar circumstances.
Thank you. Thank you for talking to us. Janet Baker, solicitor, and Sarah and Jack Hawkins, thank you very much for coming on the programme again. Thank you. And Nottingham University Hospitals Trust tell us they've completed a full review of patient safety and outcomes in their maternity service. While areas of improvement have been identified, they say outcomes in their maternity services are no different to those in other similar units in England and Wales.